What is a PET scan? So a PET scan is a scan that many cancer patients are familiar with. It's a type of whole body scan, and it has some quite unique aspects. It's very, very different from a CT scan or an MRI scan or a chest x-ray or ultrasound, anything like that. So PET stands for positron emission tomography. So tomography just means slices, so taking a lot of kind of images like cross-sectional slices and fusing them together to make a 3D image. Positrons are, try to remember my particle physics. Positrons are like the positive twin of an electron, I think. So electrons are negative particles, very, very, very small. So the opposite of an electron is a positron, so not a proton, which is much, 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 much bigger than an electron. So a PET scan, positron emission tomography scan, it uses a radioactive marker. So this is injected in you, then you generally like lie down for an hour or something while the marker works its way through your body. The marker is based on glucose, which is of course very, very common sugar, and it's had one of the atoms switched out for, I think, a radioactive fluorine atom, so like an isotope of fluorine. So this is called FDG. I guess the F stands for fluorine or fluoro. I don't remember what the rest of it stands for. But essentially it's a marker that's injected into your body, and it goes around your body, and it then shows up later on the scan. And because it's glucose, it goes to the places of your body that are hungry for glucose. So any organ that's kind of working hard, obviously your brain, because that gets a lot of your energy, and it also goes to the kidneys. I think that's not because they're trying to gobble up glucose, but just because they're always, filtering the blood, I guess. No, liver filters the blood. Kidneys are preparing urine for excretion. So, yeah, anyway, they're filtering away. So that's why your kidneys will show up nicely on the PET scan. Often when you have a PET scan, it's actually what's called a PET CT scan, which means there's a CT machine built into the PET scanner. PET scan machines are very expensive. PET scans are very, very expensive. In the US, where people often pay for their medical care, or at least in cases where the insurance company is refusing to pay, and a PET scan can cost like $14,000 or more. Just quite a sobering thought, because I've had a ton of them here in Japan. Fortunately, the fee for PET scan for many patients would be capped at like $150. So PET scan, it's a elaborate, expensive scan. Generally, you're going to turn up and be asked when you last ate. That's important because if you've like recently eaten, then that radioactive glucose is not going to go to the places it should go, because those places will already have the sugar that they require. Now, PET scans are really, really cool and useful because, well, one thing is that you can get an idea of how well organs are functioning. because the PET scan will essentially kind of indicate the metabolism going on in the organ. So they're used not just in cancer; they've many medical uses. And for cancer patients, they're very good at showing what things really are cancer tumors. There could be things that were cancer tumors and are now dead, kind of necrotic cancer tissue. There could be things that look like they might be cancer tumors but are not, kind of benign tumors. There could be, like various things that on an MRI scan or CT scan look like a cancer tumor. And then when you have a PET scan, hopefully you're told the good news, that's not a cancer tumor. PET scans are like lower resolution than CT scans and MRI scans. So I think currently, like most PET scan machines out there, you can identify things that are maybe 8 millimeters, 10 millimeters, that kind of size. If you've got a PET CT scan, you're going to have 3 images. So you've got the PET scan image, the CT scan image. So hopefully that's going to be showing things at like down to maybe 4 or 5 millimeters. And then what's called like the fused image, where those 2 images are fused together. When you have a PET scan with the combined CT scan, you don't have the CT contrast medium because the image would just be unclear, because it would be like too much contrast on the image, so it wouldn't really work. So that's why with a PET CT scan you don't have contrast medium. So you arrive for your PET scan, you haven't eaten for a certain number of hours. At some hospitals where I've had a PET scan, they give you the pinprick, like the glucose test, I think to make sure you're not lying or that you haven't had loads and loads and loads of food like the previous day or something, and I don't know. And I guess if they do the glucose test and there's too much blood sugar, they'll ask you to like come back in a few hours and they'll test you again maybe. And then you have the FDG kind of indicator injected into you, and then you're taken to like a quiet dark room. In Japan, you're not allowed to read or exercise or listen to music or anything in that time. Only in Japan would you have to like warn patients not to exercise while waiting for a scan. When I had a scan in the UK, I was told I couldn't read, but it was okay to listen to music. Not sure why the difference in policy. But the reason for that is that like if you were reading, then a lot of the glucose would go to your eyes. Presumably, there's some truth in the idea that if you were listening to music, the glucose would go into your ears. I'm not sure. I'm convinced by that, but anyway, I guess probably in Japan they're more concerned that people will be listening to something maybe on their cell phone while playing video games or whatever, and therefore the glucose will go to the eyes because your eyes are moving around a lot when you're looking. So that's a PET scan. It does involve nuclear radiation because of that radioactive dye. So you don't want to be like hugging small kids the next day or anything like that. And you'll generally be warned about that. The amount of radiation used is kind of small. Make up your own mind about the safety considerations. I've had lots of PET scans, but then I have terminal cancer, so my thoughts on risk may be different from yours. Anyway, hope that's been useful. Please post your questions and comments. Thanks a lot.